Good morning, everybody, and I'm thankful to the Respiratory team given me this opportunity here. My topic presentation is rapid diagnosis of suspected pulmonary TB in children by loop-mediated isothermal amplification in bronchoalveolar lavage fluid. The tuberculosis is among the top 10 causes of death worldwide. The incidence is 10 million developed disease in 2017. Out of the 10 million, 1 million were children. Diagnosing childhood TB is challenging because of possible disease, problems in obtaining adequate sample. The culture is although gold standard, but has low sensitivity, takes longer time. Gene experts require thermocycler of high cost. As per RNTCP guideline, every attempt should be made to prove TB diagnosis microbiologically. Advantage of LAMP over the other test, the cost is only 600 rupees per test. Results just in 40 minutes, detect bacillary load of 100 CFU per ml, detected with naked eyes and doesn't require a sophisticated setup. Advantage of bronchoscopy, direct visualization of tracheobronchial tree, sampling directly from the affected segment. The rationale for study, BAL has superiority as compared to GA or sputum. The LAMP has been approved by the WHO for the diagnosis of TB in 2016. No study till date is available in the globe on pediatric TB LAMP using BAL fluid. The study designed the cross-sectional study conducted at RML Hospital, New Delhi and All Institute of Medical Science, New Delhi. The sample was calculated based on a study by OX et al. In 2014 by taking sensitivity of 0.7067 and specificity 9.9832. The samples come out to 94 with a 5% dropout. The inclusion criteria basically based on the RNTCP guideline. The children with the radiographic lesion with a 2GA and sputum, AFB smear negative were enrolled and taken up for the bronchoscopy. Exclusion criteria is 6 children and the children who were on anti-TB drugs. The data was collected, demography and clinical detail, then BAL sample was collected and sent for the LAMP, MGIT culture, AFB staining and gene expert. The step for LAMP test is sample preparation and then DNA extraction and amplification of DNA and fluorescent detection of DNA. The 105 children was included, were meeting the criteria, and 10 has not given consent for the bronchoscopy, 20 has not given consent for the enrollment. So children finally enrolled 75. The BAL sample of 3 children were insufficient, so children included for final analysis only 72. This is the age distribution. This is the sex distribution, almost 60-40. The 60 male and 40 is female. And this is the clinical detail of the enrolled children. The fever was the positive in most of the cases. These are the bronchoscopic findings. The BAL LAMP positivity was very high in the parenchymal lesion while nodular infiltrate, cavitation, bronchiectasis, etc. The sensitivity and specificity of the BAL LAMP was calculated using the BAL culture as gold standard. This is the BAL LAMP in one side and BAL culture on the other side. The BAL positivity was, the BAL LAMP positivity was 27.78%. And the BAL culture was positive in 25%. The BAL LAMP sensitivity was turned out to be 100%, and the specificity was 96.30%, and this is the p-value was highly significant. The sensitivity of the other test, like AFB staining and BAL gene expert, and this is the area under curve, like ROC curve. The maximum area is for BAL LAMP with the best sensitivity and best specificity. This is the area under curve. The BAL LAMP was positive in 27.7 and the sensitivity 100%, specificity at 96.30. The discussion, the Petrovic et al. And the Cabra et al. Found that BAL was better for the bacteriological diagnosis of TB in comparison to the GA and sputum. WHO approved the TB LAMP based on the 13 studies conducted across the globe. The study included in 4760 cases of pulmonary TB of more than 18 years. The pooled sensitivity and specificity were found 77% of sensitivity and 97.7% of specificity. Conclusion, because of the high sensitivity and specificity, BAL lamp can be considered as a cheap, rapid diagnostic test for presumptive pulmonary TB, AFB smear negative cases with radiographic lesions. So in future, the further study at a larger scales are needed to establish the utility of TB BAL lamp in children. Limitation is small size study. Thank you. And this was my hospital where I conducted this study. Thank you very much.
Thank you. Are there any questions from the audience?
Which are important to point out. I was hoping they would come as your conclusions. You said the sensitivity is very high. No, the sensitivity is only 27%. It's not 100%. When your sensitivity or your reproducibility across culture positive is 100%. But if you look at the garden variety of tuberculosis, you're picking up only 27 to 30%. So that way, this does not add a lot of value. Neither does it add value in molecular diagnosis, because the primary reason for molecular diagnosis is to know rifampicin resistance. I'm not saying molecular diagnosis otherwise is not relevant or it is not rapid. But the policy of the country to introduce a UDST was primarily to look out for patients who would be good to go on the usual therapy versus DRTV, and for which the critical node is rifampicin sensitivity, which is not delivered by this test.
Yes.
So these are the two important limitations. Yes, it does add to the armamentarium. It does give us more answers. So I wish you had...
So sensitivity and specificity was calculated with the culture. So the culture positive was only 25, and this was positive 27.7, 25%, and this is 27.5. So all the culture positive were positive in the lamp. So that's why this sensitivity was calculated as 100% by the statistician.
I do understand that.
That was the statistician has calculated on the basis of this. The culture positivity was 25%. In 18 cases, the culture was positive. In 20 cases, the lamp was positive. Yeah. So all the 18 cases were positive for the lamp. Yeah. So that's why it is calculated 100%.
What we will do is we'll continue the discussion with Professor Singh later on, because I think he has got a valid point in discussing it. I had another operational question. How easy is it for centers to learn this technique?
Which technique?
This lamp technique. This lamp technique.
Lamp technique is very simple. And this is also approved by the WHO in 2016. And this is available for the sputum and for this GA at peripheral center.
Okay, thank you very much.
Yeah.